Yeah, the first treatment for the majority of patients with low-risk MDS, being them anemic, are ESAs, so erythropoiesis-stimulating agents. Now, one of the major problems is to evaluate whether they would respond and identify the patient would they respond for a longer time. So for many years we have some variables that we take into account. So the number of blasts, the lower risk, the fact that they do not have chromosomal abnormalities, ferritin level. Many variables have been evaluated, as well as EPO, endogenous EPO level. But what we wanted to evaluate was also the population of erythroid precursors that do respond to ESAs, and what happens when this response is lost. Therefore, we set up a cytofluorimetric method that allowed us to separate and stratify the patients for a different percentage of erythroid precursors. And it's a very interesting method because it allows you to follow up the maturation of the erythroid precursor and identify different subset of patients based on the different percentage of the stage of maturation of erythroid precursors. So we will follow up, including molecular data, but the most important thing in finding in this study is that we can quite easily evaluate bone marrow by cytofluorimetric analysis and evaluate the subpopulation of erythroid precursors.